Hi everybody, I'm here with Dr. Pierce and we're going to be talking about family psychoeducation. So Dr. Pierce is an expert in family psychoeducation, and I just want to briefly discuss why this is so important to me, because some of my patients have disorders where they lack insight and they can't progress through the treatment plan without the help and support of loved ones. And if loved ones don't understand what's going on, then they're not going to be able to provide the type of support that is necessary for the patient to go forward with their treatment plan. And that is where family psychoeducation comes in. So Dr. Pierce, tell us about your practice. Tell us about family psychoeducation. Let's hear a little bit about it.
Okay, well, my name is Dr. Johnny Pierce. I've been with Insight and Action Therapy since the middle of 2021. So actually next month makes my 3-year anniversary.
Oh.
But I've been in the field of psychology for nearly 14 years now. And without a doubt, it's essential that the family has some understanding about what their person is going through so that they can truly be supportive. I think one of the biggest things that can help a person recover from whatever the challenges they're dealing with is having that support system around them. They say it takes a village to raise a child. Well, guess what? That child grows up and becomes a part of the village. So when family understands the severity of a mental health challenge, the symptomology associated with it, how to respond in certain situations, and what type of things can possibly trigger or agitate, they tend to respond better as a whole, as a unit. They come up with a plan. They may work with a provider, or they may just have a family meeting of some sort where they check in about how they're complementing the services the person may be receiving in the form of medication or therapy.
Well, that sums it up pretty well. So where is your practice located?
So we actually have 2 offices. We have one in Ashburn, Virginia. We have one in Fairfax, Virginia. I happen to be in our Ashburn office on Tuesdays and Wednesdays, and our Fairfax office on Saturdays, and a little bit on Sunday mornings.
Oh wow, Sunday mornings.
Oh yeah,
well that's good because a lot of times people aren't able to miss work or school, so Sunday morning, that's pretty good.
Oh yeah.
So the disorders that I find have the biggest impact whenever they do get the family psychoeducation would be if somebody has a psychosis, so like schizophrenia or schizoaffective, where they are in the midst of an episode and they don't understand what's going on, or they're very, very disorganized. For example, they might have a hard time finding their way home, or they can get lost, or they need help with cooking. A lot of times there's hygiene issues. And so if the family can recognize what's going on here and that this is a sign that they're going to spiral into one of these episodes, if they're educated in this, then they can say, let's just say Billy is exhibiting symptoms that he's going to soon have a psychotic episode. So I, as the caregiver or loved one, having been educated in this, can recognize it and do the things that need to be done to get little Billy some help. Billy isn't going to be able to recognize because he is entering into an episode.
Right.
And so Billy isn't going to go and call his doctor and say, I think I'm in a psychotic episode, can you please help me with my medication? It's going to be up to the loved ones.
Yes.
And if the loved ones don't know how to recognize these things or aren't familiar with these diagnoses, then they're not going to know what to do.
Yeah.
And so I actually have, as part of a treatment plan, some patients are actually required to receive family psychoeducation because the treatment plan simply cannot go forward without help from a third party, family or friend or loved one. And so it is extraordinarily important, and not only important, but oftentimes required. There are some people that are just so very disorganized that if they don't have their family commit to taking the psychoeducation classes, I have to refer them to a higher level of care.
Yeah.
For example, an intensive outpatient program, like where they're being monitored by staff and nurses and therapists all day long. But if they have very educated and supportive friends and family, then they can actually have success in the outpatient setting. So besides psychoses, what other low insight diagnoses do you see that most benefit from the family having this type of education?
Sometimes I see with personality disorders, someone
Right.
meeting criteria for something like a borderline personality disorder, or it's not often talked about, but histrionic. these
Yeah.
different personality disorders where a person tends to have a hard time integrating things together. So people are either all good or all bad. They glorify people in one moment and then they demoralize them in the next moment. And for a family member who doesn't understand what's going on there and takes it personally, that can be really crushing. It can be hard to have somebody speak so well of you in one moment and then in the next moment you're the worst person that's ever lived. So if they can get that information in the form of one session, typically is enough to really talk through what have you been experiencing. Let me help you understand how this experience is tied to this person's symptomology. To some degree, depending on where that person is in their treatment, they may have to work this out. So it's not as if it's going to stay this way forever, just like when those psychotic episodes happen. They happen in episodes, they don't happen for all time. So the person may be able to come out of the haze long enough to be more pleasant to be around, be easier to interact with, things of that nature. But during those times that they are going through it or it's pretty rough, it really helps to be able to say to them, this makes sense. This is something that will pass. This is not really about you. This is something that they're working through. Right. And when people learn that, those episodes, they don't necessarily go great because, again, they're difficult.
Right.
But the person isn't on the other side of it crushed and can respond a bit better to that person who then returns to them in a better state. And like, wait, where were you this whole time? Well, now they understand where they were.
So the family member will learn to not take it so personally.
Yeah.
And for any medical students that are watching for the personality disorders that Dr. Pierce just talked about, the key phrases that he mentioned earlier would be black and white thinking and splitting. So those are the high yield, just in case you're about to take your psychiatry shelf exam, those would be the key words for the personality disorders that were just mentioned. So that's a great point. So psychoses, personality disorders, other diagnoses that I find lack insight. And again, it's not like to be offensive that somebody lacks insight. The organ that is dysfunctional is the brain, and that's the organ that is necessary to make decisions. And so you might not be in the best place to make decisions. Another one that I find is body dysmorphic disorder. And I absolutely have to get the parents and loved ones on board with that because nobody presents to me and says I have body dysmorphic disorder. In fact, they usually present for plastic surgery, and the plastic surgeon will call me and say, I have somebody that you need to evaluate. So they also do not have very good insight, and you can't just challenge, you can't just say like, you look fine. Like that's absolutely not the technique. You don't want to do that. But what you do need to do is educate the family about that. So do you provide some family psychoeducation for body dysmorphic or other eating disorders?
So I've been able to have some experience with eating disorders. I haven't actually had a case of body dysmorphic quite yet. But
oh, well, it's coming because one of the iPhones actually was filtering people without telling people that they were being filtered, and then everybody kind of thought that they looked better than they actually did. So there's going to be a lot of dysmorphic thoughts about one's appearance.
I can see that coming on the horizon. But with the eating disorders, I think a lot of times people focus on the behavior and they miss the emotion that's behind it. And I think more and more in the sessions that I have with clients, whether I'm talking to them about their relationships or I'm talking about their children, trying to get to that emotion that's behind the behavior, because when we are not doing so hot, we tend to act impulsively. So we act purely on the emotions that we may feel. And when we're maybe functioning at a better level or we're doing more well, we tend to be able to think before we act. So we think to process those emotions, understand where they come from, and then we can do things based on maybe previously established goals or things that we were aiming for. That's really hard for somebody to tap into when they're in the midst of crisis or they're not doing too well. And if you have an unhealthy relationship with food, or you see food as the enemy, you see it as problematic, you see weight as being something that's scary, emotions are running the show.
Yeah. And so we have talked about psychoses and personality disorders and eating disorders. Another item that I think is helpful for specifically a recommendation for family psychoeducation would be a complete dysfunctional family where it's sort of like they need family therapy, but they also on top of that need to be educated about you don't want to call them out and be like, Uncle Bob's got this disorder and this, but also you want them to understand what it means when Aunt Sally has a manic episode and things like that. So the whole family has a
spectrum of
yes,
pathology.
exactly. And so I think that that's also a very important grouping for the recommendation for family psychoeducation. What do you think?
I definitely feel that way. I typically try to frame things under the spectrum of wellness. So I think people can relate to it a little bit easier because nobody wants to see themselves as sick. No one wants to see themselves as a problem or anything like that. So when you can say to the family, like, are we operating at our best level versus are you better than your worst? Well, hopefully you'll always be better than your worst because your worst happens once and it's really low. It's like the limbo pole. We don't want to compare ourselves to that.
Right.
We want to see how high we can go. And I think that when families think about it from that perspective, they have a better opportunity of considering, like, when do we communicate well? When did we have a good vacation where everybody had a good time?
Yeah, let's replicate that.
Yes, and they think about it from that standpoint and buy into it. That, okay, even maybe it's the dad or it's the mom who feels like these kids just need to get it together. Well, maybe I can do something to contribute to that because on that family vacation, I was in a better mood. I maybe was a little bit softer, or a bit more gentle, or a bit more understanding, more empathic. I think I can work on being that way more often. And instead of pointing at the child or pointing at the parent and saying you're the problem, how can I be better? Because I have control over that.
Exactly, you have control over yourself and not other people. Maybe your kid is the problem, but there's only so much you could do. But there are things that you can do yourself to change things. And I think a lot of people focus too much on changing other people, which is like almost impossible. It's like that's probably not
let's climb Mount Everest in a day.
Right, that's probably not where you want to be putting your energy. But you can work on yourself.
Yeah.
And I always try to explain that when I tell people to work on themselves, let's say that they're in an absolutely toxic marriage and their spouse is cheating and stealing money, or actually the person is doing a lot wrong. I don't want to blame my patient and say, you need to work on you. Ideally, it would be the husband that changes his behavior, but we can't make him change. The only thing we really have to work with is your behavior, and I don't want to blame you and say that this is your fault, but I'm telling you that we need to focus on your behavior and changing it because that is what we have control over.
Right.
Not necessarily because that is the main problem, but sometimes we don't have control over what the main problem is.
It's changing the language. As long as the language is a blame-based language, then somebody's at fault, somebody's the victim, and therefore, why will we ever ask the person who's seen as the victim to do anything different? They've been wronged, and that's just the end of it. Mm-hmm. But if we can see it as we're collaborating in this relationship, we're co-creating this relationship. So I may have some habits that are problematic. You may have some habits that are problematic. How can I possibly work on mine? Because I can do that today.
You can't work on somebody else's problematic issues.
Can't do it. I usually use the metaphor of track and field. So in track and field, if you step outside of your lane, you get disqualified.
Right.
And too often, if you are looking at the hurdles in someone else's lane, you may find yourself drifting.
I like that. I'm glad it's being recorded. Because mind if I steal it? Because that's a good analogy.
No need to steal it. It's freely given.
It's free.
It's free.
Oh, I like
but
that a lot.
So we have to focus on the hurdles that are in front of us and overcome our hurdles. And in the process, trust that the other person will do the best they can with theirs.
Right. Well, that's also very difficult for people to learn to trust other people too. But these are all things that can be done in these sessions.
Right.
And I would love to work on this type of stuff, but when I'm doing medication management, I often don't have time to get the whole family in here and, discuss medications and labs and that sort of thing, and then also be like, hey, this behavior needs to stop, and that's why I do the referrals for family psychoeducation, which is just so important and sometimes a requirement. So I am glad that these services exist because it's just so important, especially with the low insight diagnoses. So the big final question that I'm going to have for you is, how do I convince people to go? Because oftentimes I will make a treatment plan and I'll say, the patient just really is too disorganized, too confused, absolutely has to have help from a loved one. And unfortunately, there are some cases where they just don't have family, and then they do have to go into those higher level care programs. But if I know that they do have family that is available, I will make it a requirement. But I find it hard to convince people to go. And people are like, oh, I have a soccer game. Well, priorities, right? Like, it is so important to understand your child's diagnosis that you really do need to go to the family psychoeducation. So for the viewers that I'm going to send, so of course, like I said, med students are watching because it's where we did the key phrases about the splitting, but also this video is going to be sent to the family members of people that I really do want to attend the family psychoeducation. So can you explain to them just how important it needs to be made a priority? Explain that it just has to be done for success to occur.
So if you are a family member for somebody who is struggling with a mental health challenge, you've gone through some things. It's been an experience for you to be on the journey with them. If they've had an episode in your home, or you've been on the road, or you've been out in public and something happened, like that happened to you too. And it may be easier to just kind of ignore it or push it away and see it as this outlier or weird event. It may even be easy to get upset with the person who in your mind may have been acting out. But if you look at them again and you see the person that you know and love, that you've known their whole life, that you've loved their whole life, and you see this person is hurting, I don't doubt for a second that you would see yourself as somebody who would want to help them. And if for whatever reason they were hurting and you didn't help them, you'd probably see that as being something wrong about you. So instead of seeing them as someone who's acted out or they're problematic or they're wrong, see them as somebody that is hurting, and consider getting psychoeducation about what's going on with them as a way of helping them heal.
Oh, good. I'm definitely sending that out, because that's a great way to think about it. It's you're helping them heal, and you also, I think another hiccup that people have is that they sometimes see mental health as like, oh, just
it's in your head.
Yeah, and the family, maybe if they think of it more as, my child has asthma, so I need to learn how to use an inhaler or nebulizer or something. So my recommendation would be, don't think of the family member like they can just turn it off. Think of it as diabetes, like you need to learn how to give your kid insulin. So that would be, if your kid has diabetes, you would get education on insulin. If your kid has asthma, you get education about inhalers. So if your child has body dysmorphic or psychosis or personality disorder, you want to also get education about that too.
Right.
Don't just say, just snap out of it. Because you don't say, when your kid's having an asthma attack, just snap out of it.
Just breathe.
That would be messed up.
Just breathe in air. That's all you need to do.
Yeah, so the family members, please think of mental health diagnoses similar to diabetes, asthma, and other things. Like, your family member can't help it, and you need to learn about it in order to support them. Any other parting words, Dr. Pierce?
Well, thank you for this opportunity. I
Yeah,
really appreciate
it's been
being able to meet
fun.
you today.
It's so important, family psychoeducation.
Oh,
so
yes. I
important.
really appreciate you giving me the opportunity to talk a little bit about this. I do want to plug our pod, because our practice has one, Insights and Actions. You can find us on any place that you stream podcasts, YouTube, anywhere. And please, for the members of the family, see yourselves as a part of what's going to make things better. This person's going through something, they're hurting, they're in pain. At times it may seem like you're dealing with two different people, because in one moment they seem to be fine and the next they seem to be off. You can help. You may not be able to help by making them do anything, but you can help by being more alert to the signs and symptoms that they may be having an episode come up, and also how to get through that episode without being crushed on the other side of it.
All right, excellent. Thank you so much.
Yes.
Thank you for watching, everybody.